LASIK candidacy is not mysterious. You have to have healthy eyes, no significant diseases of the cornea, no major diseases of the eye. You have to have a stable refraction, meaning that your glasses prescription hasn't changed year over year. You have to be old enough, over the age of 22. You have to not have cataracts. And again, it can be borderline for people in their 70s. And you have to be within a treatable range. A lot of things in life don't work. You buy it and you take it home and it doesn't do exactly what you thought it would do. LASIK will not 10 strokes off your golf game. It won't change the color of your hair. It won't make you 20 years younger, but it does what it says on the box. It actually makes your vision good. And so I think that that's the most worthwhile thing about LASIK. The vast majority of what you'll do is fill out paperwork. It's the most painful part and it's the longest part. It's 2 hours of paperwork for 10 minutes of surgery. I apologize in advance. But once you've filled out every possible thing, you feel like you're buying a new Buick. You take a little bit of Valium or Xanax to relax you, not to put you out. I don't want you asleep, but just so it doesn't, to take the edge off a little bit. We take you back into the room, you lie down, we clean the eye. I put a small speculum into the eye, a little tiny speculum to help you keep from blinking. And then we orient the laser. There are actually 2 different laser machines. The first one makes the flap, and that has a little bit of suction associated with it. Now there's no pain because your eye is numb, but you can feel pressure, and you will feel pressure. And that's just the what's called the interlace attaching to your eye. That takes about 30 seconds. You don't really feel it, but you're aware that something's happening. Then once the flap is formed, I take the suction ring off. The machine then, as insane as this sounds, checks and makes sure it's really you. It compares your eye to all the scans to make sure you didn't send your twin brother in to get your LASIK. I lift the flap, the machine orients to you, and then there's about 30 seconds on average of a clicking sound. And that's the laser actually working. It makes a little clicking sound to let you know it's working. It goes click, 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 click. The laser has a tracker, so it follows your eye if it moves, but you'll hear me asking you not to move because I don't want to work the machine too hard. So I say, look at the light, or if you're a Spanish speaker, I say, mira la luz. The laser takes about 30 seconds. Then I flood the eye with a little bit of water, float the flap back in place. I put some drops on your eye, and you're done. We go on to the next eye. In order to fully heal from LASIK, you need the epithelium around the flap to heal. Now, the epithelium of the eye is the fastest healing tissue in the body, and it'll probably heal in about 4 or 5 hours if you don't fool with it. So the best thing you can possibly do is keep your eyes closed. You cannot get in any trouble while you're sleeping. I love for patients to go home and go to sleep. I'll give you an additional Xanax to take home. Take it. You do have to put in drops. Typically I operate in the morning, so you'll probably have to take drops 3 times during the day. If you have a lovable spouse who's with you, they can give you those drops and you don't have to be disturbed. So go home, don't do anything crazy, no bungee jumping, fist fights, bar fights, nothing like that. Listening to music is better than watching television. If you keep your eyes closed as much as you can, by the time you wake up the next day, your vision will already be a lot better than it was.